lesson, I'm going to help you understand the different newborn reflexes that they're born with and how to elicit the different responses. So just a few basics to get us started. So reflexes are just inborn responses that are there for survival. Most of these reflexes have been figured out and defined as to why we do them. All reflexes of the newborn are going to disappear at a certain age or time frame, except for one of them that we'll talk about. But so they all disappear. If they do not, then it could be that there is a neurological concern. Also, if they disappear and then reappear, it could mean that there's a neuro concern. So you might not necessarily be tested on when each goes away for OB, but it'll probably show back up in pediatrics and neuro. So you need to kind of have an understanding of when they do go away. So I have come up with some different helpful tips to help you remember the range as to when each should be expected to go away that we'll go through. All right, let's look at some reflexes. So the suck reflex. The suck reflex is when a finger or a nipple is going to touch at that roof of the mouth, okay? And when that happens, the infant is just going to begin to suck. So this one is supposed to go away, or not go away, becomes voluntary. So this one doesn't really disappear. It just becomes a voluntary response at 4 months. So think about it. You put a straw in your mouth, a lollipop, you don't immediately start sucking, right? As a reflex anymore. You make the decision. It's a voluntary choice that you make to suck on that lollipop or the straw or whatever it is. And you can remember the 4 months because the word suck has 4 letters. So just, it should go away at 4 months and become a voluntary response. The next one are rooting reflex. So this one is done by stimulating the corner of the cheek or the corner of the mouth with just a finger, or it can be the breast. But in this picture, you'll see they're stimulating right there at the side of the mouth. Sorry, the image is a little blurry, but the side of the mouth, and then the baby will turn its head towards that stimulus. So this is really important for feeding. So if the breast tissue is felt by the infant over here, then it's going to turn its head that way and vice versa. This one goes away at 4 months, and you can remember that because the root word of rooting is 4 letters. Our swallowing reflex. So this occurs when the back of the throat is stimulated. So meaning there's fluid felt, food felt, whatever it is, and the baby will swallow. This is our one that doesn't go away. It's permanent, right? We always need to be able to swallow. Of course, if there's a neuro problem, a stroke, that kind of thing, then you'll see these patients that have lost this reflex and it's inhibited. So remember, we always need to be able to swallow, so that reflex will stick around and be permanent. All right, our palmar and plantar grasp. So the palmar grasp is probably one of my favorites. So this is done with a stimulus like a finger is in their hand, but in the infant's hand, and it's going to cause them to curl their little fingers around and grasp. So they will grasp with their fingers. This also happens with the toes when it's put at the foot. So the reason why it's one of my favorites is there's nothing better than a dad putting, or a mom putting the finger in the palm, and here's the infant curling the fingers around, and they believe that the baby's voluntarily holding their hand. It's just a reflex. I don't tell them that, but it's just something special to see. So the palmar grasp, this one's expected to go away, disappear around 6 months. And you can remember that because palmar is 6 letters, okay? And then 12 months for our plantar grasp. And I just remember this because at 12 months, this is the point that, or plantar grasp, if this is the point that they start walking around 12 months of age. So can you imagine if a newborn was walking around the floor and every time they felt something underneath, at the pads of their foot, they start curling their toes, right? Walking wouldn't go so well. So this one disappears around 12 months of age. Our moro or startle reflex. Now this is probably my least favorite reflex, but the moro or startle, kind of the words are used interchangeably. With this one, you gently lift the newborn up from a lying position and allow them to fall back, and it startles them, and they will spread their arms out. So you can see in this image, they'll stretch their arms out and then pull them back in. So this infant's been gently lifted and dropped back, and it's elicited the startle or moro reflex. This one's going to disappear around 4 months of age, and moro has 4 letters too. So you can remember that like that. I don't like this reflex because I don't like to scare the babies and startle them. And it's also the worst because it occurs spontaneously while they're sleeping. So my boys would always get woken up by this. They'd fall asleep on me and I'd attempt to put them down. And just when I finally thought I had them down and got comfortable, they had reflexed and woken themselves up. Swaddling is a good way to help kind of contain this reflex. Okay, so a few more important reflexes that we have. The pull to sit. This is done by pulling the infant from the supine to a sitting position. So the baby is laying down and you're going to gently pull them up to the sitting position. And there's going to be head lag. So that head is actually going to be lagging back. This one is just can show, like you'll see in neuro issues, infants that are showing signs of withdrawal and having neurological problems, the head will stay super stiff like this and be aligned. But remember, those infants don't have that neck support, the head support, so they get that head lag. So a regular baby, this one should disappear around 4 months. And you can remember pull has 4 letters, so around 4 months. And just think that's the time frame when they should have good head control and start to have those stronger muscles there when they've strengthened so they can help support their head and not have it drop back. The Babinski reflex. So this one, we're stroking the lateral side of the foot and the toes are going to fan out. So excuse my drawing here, but make sure we get 5 toes. Okay, so you're going to stroke that lateral side of the foot and then the toes are all going to just fan out. And you just gently stroke and this happens. This one's going to disappear by 2 years of age. You can remember this because Babinski has 2 B's in it, so 2 years of age. The stepping reflex, this one's done by holding the newborn up, so you just hold them straight up. And they are going to step. So they will kind of make that walking motion. Their legs will step one in front of the other. And this one goes away at around 2 months. They don't really know what the purpose is of this one because it disappears even before they're walking, but it just shows, I guess, that they can do those movements. So stepping has 2 P's in it. So this one goes away at 2 months. The crawling reflex is done by placing the newborn on the stomach. So putting the baby prone, and it's going to make, the baby will make a crawling movement with extremities. And this one disappears around 6 weeks. So 2 ways to remember this that I came up with is that the number 6 looks like crawling baby when you are writing it sideways. So that's one way. And then also, this is usually when they actually start to crawl is around 6 months. So you can remember that too, that at 6 weeks, this reflex will start to disappear. The tonic neck one, or fencing reflex, this is seen when the infant turns its head to one side, and then the arm on that same side is going to extend while the other one is flexed. So you can see in this image, the arm is extended out the same one that the head, or same direction that the head's turned, that arm's out, and then the other one is up. So you can see it looks like this baby's ready to be fencing or a sword fight. So that is the tonic neck. And fencing has 7 letters. So this one disappears by 7 months. So it's really been convenient how a lot of the time frames matched up with the number of letters to remember. There isn't a ton to know here on our management and education, but you want to try and keep the baby as calm as possible while you're assessing these reflexes. No parents want to listen to their baby scream as you're startling or doing these different reflexes to try to get the response. So just try to keep the baby calm if you can. And then when the mother has the baby to breast, you can elicit some of these responses like the rooting reflex and show her how the baby will respond and turn its head. So you're assessing it and then also just kind of educating her on what is happening. And then it will just also help her to see how to get the baby to the breast and get a big mouthful. And when you get that big mouthful, then we can see the suck reflex occur. This is also going to help protect mom's nipples by doing this. So it's just kind of a double whammy here that we're getting baby on the breast well and then assessing some of these reflexes. For our concepts, we have human development and comfort. We want to provide comfort while we're performing these various reflexes, and all of this is a part of human development. It is important to make sure the baby has the reflexes that it's supposed to. All right, let's look at some of these important different pieces. Our newborns are born with these reflexes, and they are going to help them respond to their environment. So some of them are going to be really important. The important ones are rooting, sucking, swallowing, and swallowing because we need all of these for feeding purposes, right? The reflexes are all going to disappear except for swallowing. This one stays with us, it's permanent, never leaves us. Most of the reflexes disappear around 4 to 6 months. Remember, there's a few on either side of that, 7 months or even up to just 2 weeks. So just review that, but 4 to 6 months on average. And then just remember those helpful tips I gave to help remember that. And then if they don't disappear, or if they disappear and come back, we could have a neuro problem to watch for. Make sure you check out all the resources attached to this lesson. Watch the video showing some of these reflexes. Go out and be your best selves today. And as always, happy nursing.